Hi, I'm Dr. B and today I'll be answering 16 questions with Sparkle. I drink a lot of water because it is also good for the body and for our skin. It is more effective if you're using your pointed finger for upper and lower. First question, what is your name? My name is Bianca Beley. Second question, what made you choose dentistry? I chose dentistry because I know that this profession will change a lot of people's lives by bringing back their smile and giving them the confidence to smile, laugh, and speak in front of other people. For me, dentistry is not just giving the perfect smile, but you are also giving back the function of other person's teeth. As a dentist, you're also helping your patients to eat properly and get the nutrition that they need. Number 3, share a fun fact about yourself. Fun fact about myself, ironically, I have a sweet tooth. Even if I am a dentist, I love chocolates. But of course, I am eating them in moderation. And I drink a lot of water to compensate my cravings of sweets. Number 4, how do you practice self-care? Hindi man halata, but I started working out because I really need to lose weight. And of course, I want to be healthy in these trying times of COVID-19 pandemic. I drink a lot of water because it is also good for the body and for our skin. I am having a regular checkup for my overall health, and of course, as a dentist, I need to be a role model. I really take care of my oral health because again, it is very important. Number 5, as a dentist, what is the most absurd thing that you heard a patient say? The most absurd thing I heard from a patient was nakakasugat daw ng gums yung floss and nagkikreate daw ng gaps in between our teeth. This is not true. Actually, the floss will help us dislodge or remove the debris, food, yung mga tinga in between our teeth to make it clean and to avoid tooth decay. Number 6, what is one dental myth you wish people stop believing? I wish people will stop believing that mouthwash could replace toothbrushing. Hindi po ito totoo. Akala po kasi ng ibang tao porket the mouthwash will give us that fresh breath feeling, malilinis na yung mga ngipin natin. Hindi po. Toothbrushing for 2 to 3 minutes at least twice a day is still a need para malinis yung mga ngipin natin. Number 7, is it true that brushing your teeth harder cleans more efficiently? The answer is no, and this is also a myth that I wish people will start to avoid doing. Avoid thinking that brushing harder will make your teeth cleaner and whiter. No, you should use soft bristle toothbrush for toothbrushing. Light pressure lang for 2 minutes, hindi kailangan masyadong diinan. Because the more pressure you put on brushing, the higher chance na ninipis yung ating enamel or yung outer layer ng ating ngipin. And possible din na ma-irritate yung gums natin that will lead to gum recession or yung pagbaba ng ating gilagid. So as long as you're using the proper technique, the proper toothbrush and toothpaste, your toothbrushing routine will be effective. Number 8, why is it better to floss before brushing your teeth as opposed to after? I am always saying this in my videos that for me, it is better to floss before toothbrushing. Bakit? For us to clean the in-betweens of our teeth para maalis yung mga tinga, yung mga food na na-stuck dyan nung kumain tayo. Para once you brush your teeth, maaabot ng mga brushes with the toothpaste yung mga surfaces na yon. I am always saying this in my videos that for me, it is better to floss before toothbrushing. Bakit? Para malinis natin yung mga surfaces or yung mga areas in between our teeth. Maalis natin yung mga food, yung mga tinga before tayong mag-toothbrush. Para once you brush your teeth, maaabot ng mga bristles ng toothbrush with the toothpaste yung mga surfaces na nalinis natin with the floss. By this way, we could avoid the plaque or calculus and decay from forming. Number 9, is it true that bleeding gums are normal? When we say that our gums are bleeding, it will never be normal. Bleeding is a sign that there is a problem with your gums or your gingiva. There is an irritation or there is something that causes the bleeding. Pwedeng food, plaque, or calculus or tartar in layman's term. Once you're already spitting the toothpaste with blood when you're brushing your teeth, be alarmed and get an appointment with your dentist. Number 10. Does sugar cause a lot of cavities? Sugar is not the culprit of cavities. To explain it, the bacteria in our mouth love sugar and carbohydrates. When the bacteria eat the carbs and the sugar, they will form an acid. This acid is the one who will demineralize your tooth, and then they will make cavities and tooth decay. And once this acid is mixed with our saliva, the result will be plaque buildup. So, sugar is not the culprit of cavities. It is the acid formed by the bacteria. 11. How do you achieve white teeth without compromising one for the other? As a dentist, I think I know what will harm my teeth and what food or habits I should avoid. So from time to time, I am being careful with what my body receives or what will I eat or consume. But of course, I am not restricting myself from anything as long as everything is in moderation. I will just have an oral beauty break and I will let you see how I do it. So first, I will gargle with water to remove the initial dirt from my mouth. You can use a glass or you can just use your hand. And now I will floss using the Sparkle White Dental Floss. So how will you know how long you should take from this container? So you will just pull it up to your elbow. So this is approximately 18 centimeters, just enough to clean the in-betweens of your teeth. So you will use your middle finger as an holder. So to clean your teeth, for me, it is more effective if you're using your pointed finger for upper and lower. You will use your pointed finger and you will embrace your teeth like this. Or you can use a combination of pointy finger and your thumb. So the proper flossing is you need to embrace your teeth. Like a letter C. And the good thing about it is, it's expanding. So, nag-a-adjust itong floss na ito for the size or the gap between your teeth. And then, you can show your dental floss. After removing the food debris in between your teeth or yung mga tinga-tinga nga natin, I will use the Sparkle Lemon Soda and I will use their Sparkle Ionic toothbrush to clean my teeth for 2 to 3 minutes. Ang gusto ko talaga sa toothbrush nitong Sparkle is that it just have a small head. Ibig sabihin, mas makakaabot dun sa mas malalayong parts ng ating ngipin, lalo na sa mga wisdom teeth natin. So always remember to just put a pea size, okay? You don't need a lot of toothpaste, just a pea size. Like this one, just a pea size. And then you will run a water on it and then start brushing. Just fit it so that you will not rinse off the fluoride from the toothpaste. Always remember to use a base technique or a 45-degree angle technique in toothbrushing. And then for their Sparkle Fresh and Cool, you will just get a cup of it and then you will start to gargle. It's your choice if you want to use a gargle or a mouthwash in betweens of the day. For me, I use it in betweens of the day. Sometimes I use it after brushing, sometimes not, because I don't want to rinse away the fluoride from the toothpaste. But it is also good to have the fresh and cool feeling. It will also keep your mouth clean. Don't forget to gargle at least 30 seconds. And that's my oral beauty routine with Sparkle. Number 13. How do you stop the ngilo feeling? The level of sensitivity differs from person to person, and the main cause for us to feel that pangingilo feeling is extreme temperature like super hot or super cold food or drinks. So I usually avoid this as much as possible. I am also a singer, so I don't like super cold water or drinks. Kapag ganito, there is an inward or outward motion of fluid inside our teeth kaya nakakaramdam tayo ng sensitivity. And of course, I use products that will protect and will make my teeth stronger. Products like Sparkle Toothpaste. Number 14, what is Ionic technology and how does it work? Actually, it is my second time I heard about it. The first time was I knew that it is used in hair treatments, but now I knew that it is also used for our oral health. So to explain it, the plaque or calculus are bonded to our teeth by positive ions in our saliva. So this Ionic technology found in the Sparkle Ionic Toothbrush and Mouthwash Fresh and Cool, ang ginagawa nila, they will release negative ions. And these negative ions will help to dislodge or to remove the bacteria, the plaque, and calculus that are bonded on our teeth. In short, it will act like a magnet para kahit we're just using light pressure in toothbrushing, it is easier for us to clean our teeth. Number 15, what makes you feel confident? I feel confident every time I will start my day fresh and of course whenever I have enough sleep. Every time I am speaking to other people, to my patients, and while giving consultations correctly. It also gives me an additional confidence when I know that my patients whom I treated are now educated and aware about oral health, that they're practicing what I taught them. And of course, I feel confident and happy that my patients experience the best dental service and comfort that they deserve. 16. What advice would you give to people who want a healthier mouth and brighter smile? I want to ask each and every one of you to know what's best and what's good for your teeth and your mouth. Be educated because taking care of your oral health is also taking care of your overall health and body. Use oral products like Sparkle, which is proven safe and effective. And of course, don't be afraid of going to your dentist. Like a regular medical checkup, you should also have a dental checkup at least every 6 months. Don't be shy to ask your dentist about everything you need to know to clear your mind. It's our job to educate you and answer all your concerns. Again, if you want to be confident with your oral health and you want to achieve that fresh breath and cool feeling, have the brightest smile with Sparkle.